Hello, my name is Niall McKay and welcome to Living with PSC, a podcast about the rare disease of primary sclerosing cholangitis. Now, PSC causes the bile ducts inside and outside the liver to become scarred, narrowed and eventually blocked, and leads to liver cirrhosis. In this podcast, we aim to dispel some of the myths about the disease. Today we're talking to Dr. Sharon Millen, a health psychologist based at the School of Psychology at Queen's University in Belfast in Northern Ireland. Dr. Millen is also a two-time liver transplant recipient, and she authored a report about the psychological well-being of post-transplant patients. Now, Dr. Millen got to study this from having had a transplant at 18 years of age, and then she decided to go on and do psychology and did her doctorate in this area. Not surprisingly, the report found that people who put more effort into their psychological well-being also do better physically. Welcome, Dr. Millen.
My thesis is entitled Psychological Wellbeing in Liver Transplant Patients. And I conducted this thesis as a result of me having had a liver transplant at the age of 18. And I woke up with a transplant without knowing I was going to have a transplant. So I had a virus in my liver. Eventually did my PhD in the area of health psychology, looking at psychological well-being in liver transplant patients. We created a sample of 18 adult patients, and they were aged between 29 and 70. I'm at the pre-transplant stage, and I interviewed them about how they were feeling, how their end-stage liver disease was affecting their daily lives, and then how it was affected them in a physical sense, and then social sense, an emotional sense, and then also in a financial sense, because obviously these people were no longer able to work. So there was a lot of factors that were impacting on a person's life because of their condition. 1 month time point, we looked again at sort of the immediate post-transplant concerns. 3 months were people just kind of reintegrating themselves back into society. And 9 months was about almost fully healed physically and regaining their normality and their independence back again.
Did you have AIH or PSC or anything like that, or was it another disease?
I had a virus in my liver, which was called non-B hepatitis, so it wasn't actually identified. And it was something that caused me to feel unwell for around 3 months, and then I started to feel extremely unwell, but nobody at any stage predicted the liver to actually fail. So it actually failed very suddenly, and I went into stage 4 hepatic encephalopathy one night. I think the fact that I was only 18 in an adult hospital and had never actually been in Dublin before in my life, having woken up with a liver transplant and a scar and pads in my stomach was very overwhelming and psychologically very traumatic. You might know yourself now, a lot of outcomes for transplant patients are physiologically focused. So people are, it's a lot based on your blood results, how you're feeling, your scans, which I can understand because that's where the success of liver transplant is measured, I suppose. But at the same time, I think psychological well-being is as equally important. So there's a lot of concerns and challenges, I suppose, in the end stage part of people's experience, and also in the very early stages of the transplant, where people are faced with uncertainties around rejection, about risks of infection, and a whole different life as a transplant patient. So I think there's a lot of challenges, and I think psychological support is very important for people to improve their physiological outcomes as well as their psychological outcomes.
I suppose if I were to look back on it, I wish I'd given myself a bit of an easier time of it when I was going through it.
Absolutely. That's very, very true to what my experience was like both times, especially on the first transplant, which was when I was 18, as I just said. My main objective was get back home and be normal like my friends, my peers. And but at that stage, I put so much pressure on myself, and I was suffering a lot of post-transplant complications because I was on a lot of new medication, high doses of medication. And as a young teenage girl, and appearance was very important to me, that caused a lot of psychological trauma as well. I was having a lot of excessive hair growth, moon-shaped face. I was having skin tags having to be removed. I was having CMV several times and being rehospitalized. And all of those things were a heavy burden for me to carry as a young girl. And all I was trying to do was push myself to get on with life as if that didn't happen. And I think it's important for people to realise that when you go through something like this, you have a different view on life and you can reprioritise what's important in life.
Yeah, and I found actually pre-transplant when I was getting recurring cholangitis that I got cholangitis when my father died. I got cholangitis when my finals were due. I was doing a master's program at the time. So, which is very much the findings of your report. And I suppose you were ahead of the posse because you had actually experienced it.
Yeah, that's right. I think for me, that was the key thing, that I had experienced it. And I think it was important for me moving forward to try and put some information out there for other people to realise that, there are psychological challenges associated with going through something like this. And back then, it was 1997, and my family also had gone through the trauma with me. When I got out of hospital, part of my coping strategy was to protect them in a way. So I was trying to pretend, I suppose, that everything was fine psychologically, and their perception of how I was getting on was she's fine. It is important to recover physically, but a large part of that is talking about your psychological challenges and acknowledging that there are psychological challenges, and I suppose talking to other patients or other recipients about that, and different coping strategies can maybe help that a little bit better, like active coping or acceptance or social support is a key component in predicting good psychological well-being in patients. If people have good social support and the family are also aware and educated on how what the challenges are, it predicts a better outcome overall for patients.
I tried to insulate my wife from a lot of it. It was only towards the end when I would include her in meetings when I came in for appointments with the doctors or the consultants and stuff. And I mean, part of the reason was unselfish, but part of the reason was selfish. I kind of thought as well that I'm going to really need her at some stage, so I don't want to bother her with this small stuff.
Yeah.
I'm going to really need, like, I kind of knew that I was going to this thing and that I might really need a lot of help at some stage. And I was afraid. I didn't know how much a lot of help would be. Like, was that incapacitation? So I wouldn't tell her how I was feeling. I would just sort of go on grand and watch Netflix and stuff like that,
Yeah. And I think, that is one of the more positive coping strategies that have come up in my thesis also, that people have ways in which they self-distract in order to cope, so they're not facing this head on all of the time. And another thing you mentioned was really interesting about dynamics in relationships. So one of the things that has come out with research is that when the patient is deteriorating in their health and their independence is going downhill and they're starting to become more and more dependent on their spouse or their loved one, the dynamics change in the relationship. And then when the transplant happens and the patient is starting to really, really want to regain all of their levels of independence, going back to work, exercising, going out, socializing, sometimes that causes friction within the relationship because their loved one then starts to be afraid because of all of these, and people often split up. There's a lot of research to show that post-transplant, when people are starting to regain their independence, if they've been chronically ill for a long time, relationships break down because of this change in roles and change in dynamics.
Yeah, because there's so much changing. And then there's so many things that you're doing to cope with the situation, not all of which may be healthy. And I don't mean physically unhealthy, I just mean psychologically unhealthy, whether it's, distracting yourself in some way or whatever, because effectively what you're doing then is you're really not being present, and it's hard to have a relationship with anybody who's not there, it's in terms of, well, I think one of the things that I mean, you definitely pointed up, but you had a percentage of people who hit sort of depression after transplant.
Yeah, so research has shown in the past that around 25% of liver transplant patients show levels of psychiatric morbidity. So it's clinical depression and anxiety. Now, that is within the first 9 months post-transplant. So I think largely that 25% would be people who are common to terms with the post-operative complications and the concerns. A large number of people experience rejection or infection or rehospitalization. So most people do experience a form of complication. You're taking medication maybe 4 times a day, different kinds of medication. They're having side effects. You're having maybe problems with your appetite, problems with weight gain, problems with fatigue. And I think a lot of people during that first 9 months are just adjusting to this new life and adjusting to what they're able to do and what they're not able to do, and finding their own boundaries and adjusting their own goalposts. And I think after that first 9 months to a year, that percentage does drop significantly. So, there doesn't seem to be a significant amount of psychiatric morbidity for people post 1 year generally. And that's because life does improve. For most people, people are largely able to regain normality and go and start doing the things they enjoy in life again, such as socialising or work. For transplant patients, we're facing a unique challenge, which is all around acceptance of the donor organ. And whenever you're waiting for your transplant, you know that in order for you to get this much anticipated life-saving gift of a donor organ, someone is going to die for you to get that liver. And I think a lot of people struggle with, I suppose, guilt at that point. And then post-transplant, a portion of people do struggle with having to try to integrate that organ within their body. And some research has actually shown those that show poor coping skills actually consider it to be external, like an external organ. And there's some people call it like a Frankenstein syndrome, where they feel like they're not whole anymore and they've got bits and pieces of other people, and people name it, and people cope with it, the receiving of a donor organ in different ways. And people who don't integrate with it properly, they suffer anxiety. Sometimes people don't want to leave the house because they're afraid of the risk of infection. And that really does spiral for people that have their mental health spirals in those circumstances. And I suppose people like that, then, those are the people that then don't adhere to the medical regime because they don't have the coping skills to equip them properly to really deal with the complexity of it, and they can't accept that they are a transplant recipient. I think it's really important for people to have counselling provision to avail of on a confidential basis pre and post-transplant for things like that, because people don't really want to talk about it all the time, especially because you've received this gift of life. You've been listed. People tend to feel really grateful that they've been listed and they've been able to go through the operation successfully. And you don't want to seem ungrateful that you have got these challenges psychologically, and you don't want to voice them to your medical team, I suppose, because you don't want to be ungrateful for this gift of life because they're so scarce and so precious, and the donor family is giving it to you and your donor. And so therefore, a lot of transplant recipients tend to keep that information to themselves because they don't want to seem ungrateful. And I think it's really important to have a provision of counselling service for people to talk confidentially about that.
Yeah, I've been really lucky because I was in therapy before I got the transplant. I kind of realized I needed to, and kept it up afterwards. And I've had all the resources at my, and I've done like, the answer for me was to do everything, like to just, embrace it all, so I've done all sorts of different shamanistic practices and all these, which, whether you believe specifically or not in the actual practice itself, it's the way to connect with yourself and with other people and to connect with your body that for me has been looking at, and I still found it challenging. But the other thing you said there is that I kind of view my liver as my guy. It's like, my guy and me go to Spain, my guy and me go out around the world, you know what I mean? And that way it feels to me like if it was me and I didn't make it past this point, that I would be delighted if one of my organs helped somebody and I could be their guy,
Yeah.
So that's how I had to view it. People were saying, do you feel different? Have you got any personality changes? I didn't.
No.
I asked my wife. She said, no, unfortunately not. No personality changes.
I think people do cope with it differently. And what you said there about your mental preparation pre-transplant was a really important factor that did come up in my research. And in fact, I did 2 case studies. I pulled out the person who showed the highest quality of life at the 9-month post-transplant compared to the guy who showed the lowest quality of life at the 9-month post-transplant. And both these patients were male of the same age with the same presentation, which was hemochromatosis, hepatitis C, and they had also hepatocellular carcinoma at that stage. And the person who showed the best outcome with the highest quality of life post-transplant was the guy who did meditation, who was doing a lot of work pre-transplant on his body to accept this new donor organ. And he explained how he talked to his body, how he spent a lot of time preparing mentally and reading resources and educating himself and educating his loved ones and really, really thinking about how life is going to be after. And also what he did was make sure that he was realistic with his goals at each time point instead of hoping to regain all of these roles, I suppose, in life really early on, and then that leading to disappointment and frustration with himself. So
I did work in filmmaking and writing, and I can't do it anymore, really, because to work is to overwork. Like, you work very intensely on projects for short periods of time. My body can't do it. Right? So I've come to what you've done. I'm looking at counselling and psychotherapy as a job, I suppose. I can set more manageable expectations for myself,
Yeah. And that's it. I think post-transplant, we regain such a lot of normality and our physical health is really good. But there are limitations because I do overwork myself. And sometimes I just have to say no to some things. And
do you mind me asking, what was it, rejection or something? What prompted the second liver transplant?
Yeah, the second liver transplant was due to rejection. I had the liver for 20 years. And it was a strange situation because it happened in 2016 and I was probably the most fit I had ever been at that point in my life. I was training for the British Transplant Games and I had been to the Transplant Games in the August. And I felt really, really fit, but I did notice I was flagging a bit in the sprints. And I came home and a couple of weeks later, I started to feel nauseous when I was eating, and I went to the mirror at the window and looked at the whites of my eyes and they were starting to become a little bit discoloured, and I thought, not again, this could not be happening, because my blood results prior to going to the Transplant Games were all normal. So I went to the regional liver unit here in the north and I got some further tests done, and they said basically, go home, pack a bag and come in, cancel all your plans because your liver tests are now all over the place. So that was so sudden, but it was rejection, yeah. And I went into hospital on the 7th of September 2016 and didn't get out for 7 months, had the transplant, and, it was very quick again the second time around. And then I suffered a lot of post-transplant complications second time with pneumonia and infection and things like that. So, yeah, that was a struggle the second time, but it took me a long time to recover from that, also a lot longer, I suppose, from the first time because it was the second. But yeah, that was a thing called ductopenia, where the biliary tree just kind of dissolved and the liver rejected.
And did you have any post-operative delirium or anything like that if you were in the ICU for a long time?
I did. I had post-operative delirium, and I was in ICU after my transplant for probably only a couple of days, and then I was discharged to the step-down unit. I had my second transplant in King's College Hospital in London, and I was discharged to the step-down unit and then into the main liver ward, which is called Todd's ward in King's. And there I started to suffer from pneumonia and sepsis. And after that period was a massive struggle for me psychologically. When I was discharged back out of ICU that time, I just felt like I'd gone through the washing machine several times. I was completely drained. Don't think I could have done that without support of others at that point. That was a real breaking point at that stage for me.
Yeah, and this is you having done a PhD in this topic.
Yeah,
so
exactly.
If you don't have struggles after your transplant, that's wonderful.
And I think largely what happens for people is length of time leading up to your transplant and the severity, I suppose, of your, I know everyone's condition is severe, but some people have a lot more complications prior to their transplant, and then there are complications post-transplant. I think all of that is associated with the level of trauma people experience and the challenges that people experience post-transplant. For some people, they're in hospital out in 2 weeks. And I know some people that have short hospital stays tend to experience less psychological trauma than those who have longer ICU stays and longer hospital stays. So that's an interesting fact for people to consider.
And back to the report, so to the thesis. So the findings of the thesis were.
So the findings of the thesis were that patients who have better psychological well-being post-transplant tended to show coping strategies through my quantitative measures that had active coping, which was sort of preparation, information seeking, people who had social support, and people that were, I suppose, mentally preparing for their transplant. And so when I did correlations, I know the sample size was small, but we did some correlations with the quantitative measures. I should have mentioned I did quantitative measures looking at quality of life, anxiety, depression, coping skills, and optimism levels. So there was sort of a predictor or determinants of psychological well-being post-transplant when patients demonstrated those coping strategies pre-transplant. But what I did find interesting was patients, when they were scoring their quality of life pre-transplant, scored their quality of life in the mid-range of the scale, which you wouldn't expect, because they were suffering from such a debilitating illness. And the fact that we also included interviews within the study, we were able to tap into how their condition was affecting their daily life and psychological challenges they were facing and emotional challenges, and how the social isolation aspect was a real problem. So the interviews were allowing us to get a better in-depth flavour of the problems that people were experiencing pre-transplant. And the fact that they were scoring higher than expected on the quantitative measures is just an indication of patients adapting to their health state at that point. I think what was interesting was that people that were pre-transplant were experiencing hepatic encephalopathy a lot of the time. And the hepatic encephalopathy was a real problem for people because it was preventing them from driving, and that, as a result, was preventing them from socialising, along with the fatigue aspect of things. And then the nausea and just the problems with eating also prevented people from socialising. And also the fact that they had struggles with finances because they couldn't work was another problem. And I think people that were able to utilise social support, and social support wasn't just family members, it was other transplant recipients or patients maybe that had met within the hospital at hospital stays, because back then there was no LISTEN. That LISTEN in the South or in the Republic of Ireland has only come about, obviously, in the last couple of years. So when this study was carried out in Vincent's, there was no support network. So people were gathering or gaining social support from other patients through their hospital stays and sometimes at clinics. And other key parts of social support for people were the hospital staff. People found that really, really, really useful to be able to talk to the transplant coordinators, and also their family members. And also work, to have an understanding employer was really, really useful and really key. And I think for the post-transplant phase of the research, what I did find there was anxiety was actually at its highest in the 1 month post-transplant. So it actually went up from the pre-transplant stage. And the post-transplant 1 month was characterised with a lot of complexities. As I was saying earlier, people at times were still inpatients at that point. So they were grappling with this new life as a liver transplant patient. They were coming to terms with maybe not being able to do things like eat certain foods. People were wary of being around others with infection. Some people were wary with pets. And there was just a whole change and a whole uncertainty and a question mark around what life would be like, and would they be able to actually do the things that they once considered to be normal in their life. At the 3 month post-transplant time point, the anxiety had come down somewhat, and people were starting to come to terms with life as a transplant patient and become used to their new complex medical regime. But if they had missed a medication, for example, this was sending their anxiety through the roof because they were thinking, I've missed a tablet, what's going to happen? I'm going to die. So there was a lot of fear around, the threat of rejection and the fact that rejection is silent. People were afraid, what's going on inside my body? I can't tell if it's happening. I'm not sure what's going on. How do I know this is going to happen? So there was a stress, anxiety, fear around this real threat of rejection at the 3 month time point. And at 9 months, people had started to settle into their lives. And I suppose, as I was saying, they were using distraction techniques like, just going for walks, going and shopping, doing things that maybe felt comforting to them and starting to feel like their life was coming together again. So there was a real shift in anxiety from the 1 month to the 9 month, and the quality of life constantly did start to improve. Although at the 9 month time point, quality of life did reduce slightly in the quantitative scale, and that was, we think, because of people having experienced post-operative complications at that point.
Yeah.
Yeah.
Well, of course, many of us, we have PSC, so PSC recurs, and the recurrence rate is supposed to be about 30%, but actually, recent studies are showing it's higher than that. First 6 months, I was just really doing everything I could to try and get back to health and exercising every day and all that. I was very concentrated on that. But then after that, I had a lot of childhood trauma, and I found that the post-operative experience, or the trauma of the operation, seemed to bring back all of that stuff. And I found myself having to go what I thought was backwards, because I had already dealt with a lot of this, or I thought I had already dealt with a lot of this stuff, but I don't know if I'd really felt it. So I found myself having to dig in very significantly in a psychological sense to try and get my head straight, because it just all came back.
Yeah. And I think that's it. I think whenever you're dealing with trauma in the past, you think you've dealt with it because you're kind of functioning on a higher level in a normal everyday life. But when your health state is challenged, you're having to dig deep into a survival instinct within inside your body. And I think anything you think you've dealt with, it opens a lid within your head and everything starts to come out. And everything you think you've dealt with, all of your repressed thoughts and memories start to come out, because you're utilizing all of your resources. There's nothing that you can kind of press down anymore. And I think it's just, everything is for survival at that point. And it's sort of your true self starts to come out at that point. And it's a really vulnerable place to be.
Yeah, that's really interesting, because I think as well, you can embrace that true self, or try and reject it. Try and put the lid back on.
I think it's a really good opportunity to embrace it. I think by embracing it, you're able just to talk to your younger self, I suppose, sometimes, and say, things are okay. Things are okay now, and resolve anything that you might have had problems with and move forward together with your younger self, if that makes sense.
It makes total sense to me. I got involved with IFS therapy, the internal family systems, where you're sort of dealing with your younger self. And I also got involved with holotropic breathing. That helped me in several ways. It helped me in the fact that I think it actually just moved all my organs about.
Mm-hmm.
So it helped with pain. And then it sort of helped me connect with that younger self as well. And the post-operative delirium as well was such a trippy experience that I can either take that as just being completely stoned and it didn't matter at all. And I remember a nurse saying to me, I was like, I don't like this. And he was like, we're trying to get you to Monday, Niall. Like, we have to get you through this process. We got to get you out of the ICU, so take the drugs. It was such a trippy experience that and in retrospect, I've sort of embraced it. It felt like that sort of standing on the precipice between life and death, and kind of realizing, okay, here I am.
Absolutely. And I think that was the thing that I feared most when I was facing my second. Obviously, my first transplant, I didn't know was going to happen. I woke up with a transplant and it was awful. The experience I had with morphine, and I was thinking there was parties in the room. I thought there was a person opposite me in a body bag, and I'm speaking to them. I actually pulled the tubes out of my nose. I thought I was on a train, and I thought the hospital had thrown me out because I'd sabotaged my own tests. Everything was just hell. In fact, they called my parents to come into the room because I was in a state of delirium, and my dad had to go, you're okay, to try and get me out of it. And so I remember that vividly. And the second time around, I knew that I was having the transplant, and I knew that I was going to go into the state of uncontrollability within my mind. And that was the most frightening part for me, because I knew I can control most aspects of this. I'm informed because I've learned about it. I've studied it through my PhD. I've been through it once before. All of that for me was okay. I could rationalize that in my head. The part that I was most afraid of was this uncontrollability of my mental state. What was I going to think? How was I going to feel? And I couldn't prepare for that because I wasn't sure how. You don't know what was going to happen. And so I actually was afraid to take the medication at the start until I had to give in and take it. But no, the second time round wasn't as severe because I wasn't in ICU the first time round as long as I was for my first transplant.
I feel I want to tell people is that it's all okay. It's all normal.
You're in survival mode, and you're kind of just trying to channel all your energy into staying alive until the operation is over. And I suppose you're not really taking on board what people are telling you, because a lot of it is quite frightening as well, pre-transplant, when they're telling information about what might happen. But yeah, I think what people do, I suppose, need to take on board is, yeah, you might feel anxious, you might feel a little down afterwards, but importantly, reach out and talk about it, because you're not alone. Everybody experiences this to some degree, and by talking to other people about what you're going through, it will really, really help, because it's part of the process and it will get better and you will have a normal life again.
Well, I'm afraid that's all the time we have for this week. For more information about PSC and for a list of people and topics we'll be covering in the near future, please go to www.pscpartners.org. That's www.pscpartners.org. PSC Partners is a non-profit organisation dedicated to providing education and support to primary sclerosing cholangitis patients. There is information and resources on the website. There is a conference once a year. There is a private Facebook group that you can also join. Also, please join our patient registry. This is an anonymous database that provides research support to the medical community who are researching this disease. Thank you very much for listening.